Hi, there's fatigue setting in. When does this end? How does India move forward? Experts' opinions and scientific advice is drowning everybody. Yet we can't seem to find clarity or a solid constructive framework for the road ahead. At Newsworthy, for this series of videos on how India moves forward, we're putting out a solutions framework. It's granular, it's suggested by people in the know-how. These need to be corrected as soon as possible and in all likelihood will make a difference. Tonight, our focus is public health communication. It's simple, but it's a key component of an effective response. It's between governments, health professionals, scientists, media, and the public. And all these stakeholders are important. Here's a list of 10 points that Pallavi and self have collected from some of the best minds on public health communication. Number 1, communication has to be daily, preferably led by scientists and health professionals. Right now, information and confusion is coming from sporadic press conferences, off-the-cuff remarks, jargon-filled ICMR guidelines, and heavy PDFs. Worsted states should also speak daily. The floor should be open to all questions. Number 2, solve the mixed messaging. There's confusing messaging on CT scans, remdesivir, ivermectin, plasma, second dosage. It needs to stop. Tell people what works, what doesn't, what the science says, but simplify it. What is approved, what is not. What communication is treatment protocol for doctors and what communication is for people. Club all the related information together. Preempt all possible scenarios that people can be in and answer them clearly. So if it's about a vaccine, what does that mean for people with asthma, lupus, one kidney? Don't leave the onus on people and individual practitioners. Number 3, be transparent. When something has gone wrong or if a policy has been changed to navigate either a different or a difficult situation. Back it up with science and again communicate or clarify all aspects. Number 4, fine-tune all policy of course, but also separate communication for rural and urban India. Mass awareness, mass education, and direction is crucial. We need simple, vernacular, jargon-free, layperson language. One slow, long caller tune across India at a time when people need to make SOS calls and time is of the essence is not going to cut. A compassionate, calm tone helps. The driving force in all of this messaging is science and public health. The messages need to have a heart and a head, a clear call to action. You need to do this with emotional and local approaches.
The anatomy of a good public health message, according to experts and the World Health Organization, is appeal, approach, content, text or image, and a trustworthy source. Use the most relevant celebrities, influencers, and local leaders. Point number 5. Once a message has been created, it must be inclusive and reach everyone. Governments and institutions can have a trust deficit, but if the message comes from grassroots leaders, religious leaders, teachers, community members, it makes more sense. It's a bit late in the day, but value your ASHA workers, your Anganwadi workers, pay and protect them well. They are the ones who can ensure last mile message delivery. Use their strong community health partnerships to send the message, but also listen to them. Keep your ears open as to what communities are hearing. Point number 6. Media, television, social media, and influencers are all fine. But also use loudspeakers, radio, billboards, paintings on walls, consistent persuasive communication on Doordarshan, All India Radio. Written public health information should be accompanied by a visual element, easy to understand, and for all, including those with hearing and sight impairments and those who are neuroatypical. Informing people about preventative care can be difficult because often people don't listen enough to information about potentially becoming ill. But if preventative care is crucial to reducing the gravity of a public health crisis, then getting people to understand how important it is becomes critical. So speak clearly and repeatedly on safety protocol and symptoms. There is no one standard way to explain what isolating at home or social distancing can mean, especially in slums and small towns. Explain how a local primary center can handle mild cases and when care should be sought and how. Point number 7, underscore that masking works, washing your hands works, vaccines work. But don't stop there. People can't afford masks and oximeters. A part of spreading awareness should include distribution of these items. And point number 8, communicate effectively about the suspension of all mass gatherings, religious, social, celebratory events, especially in small towns and villages. Work with NGOs, religious leaders, and community health workers familiar with local needs and customs to make sure that this is implemented.
Number 9, marginalized communities with little or no exposure to mass media and others can fall prey to rumors. In fact, rumors about the oral polio vaccine affecting fertility were overcome with the help of local opinion leaders from those very communities. So have a dedicated group of people who are tracking rumors and misinformation on social media. Take action against them, but also immediately clarify with facts and broadcast it in places other than Twitter. And number 10, finally, politics can obfuscate an important public health message. Avoid it at all costs. We'll stop here. This list is not to suggest that some of this is not happening. Neither is it to suggest that we know it all or presume that this video will be heard in rooms where decisions are being made. This is an honest attempt to articulate a way out of this confusion and frustration that many are feeling, not just because of what the pandemic has done to their lives, but also because they can't find direction and empathy from leaders that be. If this has been worthy of your time, please share it far and wide. We'll come back with another one in this series very soon. My name is Anubha Bhonsle, and you've been watching us here on Newsworthy.